Hi, I'm Dr. Brockenshire, and I wanted to take this opportunity to explain some exciting developments in chiropractic from a neurologic science point of view and help understand and introduce people to what chiropractic science and chiropractic philosophy really is all about. You can go to our website and learn a lot more about many of the things we do and the lifestyle that we promote, and a lot about nutrition and functional neurology. But let's take the next couple minutes to really understand what an adjustment is, what chiropractic is, and what it really means to be healthy. So, in the past, you may have heard that chiropractic is all about cracking your backs, or once you go to a chiropractor, you always have to keep going, or chiropractors can hurt you, chiropractor could kill you, chiropractor could give you a stroke. None of those statements are true. As a matter of fact, there's been exhaustive research done on those statements. However, when you do start getting your spinal cord and your central nervous system corrected, you feel better. You can do more. You have more energy. You sleep better. And I'm going to show you why that happens. Because it's not about cracking the bones, it's about range of motion, it's about posture, it's about how your brain controls the movement of your body in your day to day. Really, a back problem is a brain problem. So when we look at what an adjustment can do, and an adjustment is really what chiropractors call their method of treatment. It's usually done by hand. However, there are some instruments that have been approved for delivering adjustments. But at the cellular level, when somebody receives an adjustment, when it's done correctly, to the right vertebrae at the right time with the right amount of pressure, so on and so forth, you start to create a whole cascade of things that start to happen in the body, particularly in the brain. And when we look at the fight or flight mechanism, that's really what happens when your mid-back is treated. The rest and digest section of your back over here, or the vagal system, which you may know of as the vagus nerve. Notice that the TMJ, or your temporomandibular joint, also known as your jaw, is included in there. So when you have adjustments to this region of your neck, the rest and digest system kicks in. So many people report feeling very calm or relaxed or restful after a neck adjustment. If their mid-back is adjusted, they usually feel a little boost in energy. And many chiropractors will treat the whole spine. Chiropractic doesn't just focus on the spine, though. We work on rehab, we work on functional movement dynamics, physical therapy. A lot of chiropractors are also physical therapists. We do get into joint manipulation of the wrists and the shoulders, the knees, the ankles, even the ears can be adjusted. But when we use the word adjustment, we're really talking about treatment that's done to the spine and central nervous system. And when we start working on the extremities, we refer to that as manipulation. Now, you may have heard some outlandish claims. Chiropractors might have a billboard say, we treat diabetes, or we treat depression, or anxiety, or ADD. That's not true. Chiropractic doesn't treat diseases. The way chiropractic works is it gets the body's immune system back in sync with the brain so the brain can actually communicate with the rest of the system properly. Much like your computer, if you're getting bad information in, you're going to get bad information out. So stress is probably the number one thing chiropractic benefits the most, because a healthy, balanced brain allows for a healthy stress response. And so we've seen things like blood pressure can be lowered by cervical adjustments, and that's a medical fact. The Journal of the American Medical Association actually recommends chiropractic adjustments to the neck for lowering blood pressure. And feel free to Google that, because it is out there. We know that we are experts in low back pain, and we are experts in reducing pain overall from a drug-free, surgical-free point of view. Now, chiropractic also dabbles in holistic medicine. It's not naturopathic medicine. Okay, remember, our goal is to have the ultimate nervous system. We want to have the best brain on the block, because if that's where we are, then we can do pretty much anything. So remember, we're talking about a brain problem, not a back problem. The research currently from 2015 and 2016 looks at what happens when you perform adjustments to the spine. And in fact, it's actually proving what the doctors of old used to know in the 1900s, and that adjustments to the mid-back do affect things like the liver and the heart. Adjustments to the upper neck can affect the colon. Adjustments to the very low back affect things like menstrual cramps and the prostate gland. So there's a lot more research coming out of academia on how chiropractic works because it's one of those situations where not only is it safe, it's extremely cost effective. In many cases, for a few $100s, you can solve a problem. If you go to the ER today with low back pain, you're not getting out of there for under a couple grand. And so it still remains the go-to recommendation for most people before you enter into Western medicine. If it's a back, neck related situation, you check with your chiropractic first. But today, many people are also using their chiropractors as kind of a primary care portal of entry physician. And in fact, here in the state of Michigan, that is our new task, that a licensed chiropractic physician's job is to be the first line in many cases. And then when needed, we have the ability to refer out. We do not prescribe medication ever. It goes against the whole purpose of chiropractic, which is restore the brain's optimal integrity and optimal function, drug-free and surgical-free. And this is not a new concept. When you look at the teachers at Harvard's medical school, the medical professors echo the exact same types of philosophies that chiropractic follows. And that is the body was born with the best doctor it'll ever need. All that doctor needs is time, rest, and the right tools, meaning good nutrition and water, to get the job done. The purpose of a doctor is to teach the patient how to work with their own natural healing potential and open more doors of healing for them using proper adjustments, proper brain technique, proper exercise, and the best nutrition available. So that's why we do what we do, and that's how we get it done. Remember, a back problem is really a brain problem. And if you have more questions about how all this works or you'd like to see it in action, check out our website or come on by the office in Plymouth and meet our amazing team of specialists. We handle all sorts of problems, and we'd love to see you and we'd love to meet you.